I am going to speak about oral health issues in Southern Africa. And this is in the case of Malawi, specifically because that's where I'm studying right now. That's where I am practicing right now as a dental intern. And this will kind of go towards the ministry opportunity for Adventist professions, business persons, and supporting ministries. Now, oral health is an integral and essential part to general health, and it implies in being free from oral diseases and disorders that affect the oral cavity, or in other terms, the mouth. There is an interrelationship between the oral and general diseases, and it is scientifically proven. We're going to go through this as we go about in the presentation. And this is usually because there is a lot of common factors, or rather risk factors, that correlate between the oral and general diseases. Okay. In oral health issues, we tackle with a lot of diseases, but to be just kind of to speak of a few, I'm going to talk about the dental caries, the pleomorphic adenoma. It's pleomorphic adenoma, not polymorphic. And there's also squamous cell carcinoma. And squamous cell carcinoma is the main disease that we will tackle around today. And I will tell you why as the presentation goes by as well. And we have the risk factors for squamous cell carcinoma. I will talk about it and to define as well as what it is. There is alcohol involved intake, and there is smoking, and there's also compromised immunity like HIV/AIDS and others as well. Now, when we talk about squamous cell carcinoma, it is a disease, rather it is a cancer, or we can say an oral tumor as well, where it starts. Usually, you can have it everywhere on any part of your body, any organ of your body. But usually, squamous means kind of like the skin. That's where you get it from, and it's a cancer of the skin. So, for example, for me as a dentist, we find it usually the most common place. It's under the tongue, or by the tongue specifically. As it starts you can see the picture on your left side, the first one. It starts very small, and usually it attacks the squamous cells, and that's why it's called squamous cell carcinoma. It is a type of cancer that we get if you don't take care of your oral cavity, especially if you smoke, if you drink alcohol, if you are maybe immunely compromised with a specific systemic disease, as we talked about, HIV to be specific. Now, to the right side of the other picture, now that's the worst part of what could possibly happen. Actually, it can be worse than this, where it grows all the way out of your mouth, and you can't. Now this is the part where it's so hard or almost impossible for us to treat as dental practitioners. So usually what I've observed at where I work back home in Malawi is that unless someone feels pain orally, that is when they feel the need to come to the dental practitioner, or rather to come to the dental clinic. This presentation seeks to bring about an awareness of subtle oral health issues prevalent in Southern Africa, specifically in Malawi, with particular emphasis on squamous cell carcinoma. It is one of the most common oral cancers that we encounter with almost always on a daily basis, or rather at least we get maybe two per month kind of cases of squamous cell carcinoma. This type of cancer is usually curable when it is discovered early, and the opposite is true. So for example, as we spoke about previously, there was usually if a patient comes early at the hospital, it's easy for us to be able to treat it at an earlier stage, or let's say, to be precise, stage 1 of that type of cancer. But then if they come a bit later, like stage 3, or an advanced stage like stage 4, it is almost impossible for us to treat it to have a good prognosis or a good outcome. And so now squamous cell carcinoma may be prevented with the structured community oral health education program to which Adventist business persons, professionals, and supporting ministries may choose to be a part of. Now, what scholars are saying, there's this doctor in India, Dr. Olak. He talks about in developing countries, many people are malnourished and they live in unsanitary conditions, and they can barely afford to pay any type of medical treatment, with few dental clinics as well. And also, there's also the technological aspect of this, meaning that probably the high quality kind of technology we barely have, and it's hard for us to actually be able to do more things than we could have if we had those high quality machines or something. For example, we do have x-rays, but then they might be old from long time ago, and we can't be able to make a proper diagnosis because we don't have this kind of high-tech machines at this time. And then issues on the ground that I've kind of observed, that I've seen during my time of practice right now. Firstly, we do, as we spoke, as I just talked about earlier, lack of adequate facilities for high-quality oral health care despite the availability of primary health centers. Now, this, we could have, usually, like in Malawi, we do have 3 central hospitals, and I work in one of the central hospitals, but as we can see, there's also some small clinics that are in the outskirts of the cities. And these are the hospitals, or rather the primary health centers, that lack a lot more things than the central hospitals that we have. Now, for example, most doctors are not willing to work in these kind of districts or in the primary centers of the city because there is not much infrastructure, and at the same time, there is low salaries that they receive. Now, this is the other issue that we're tackling, that there is a lack of structured oral health education system. And this is the main thing that we're lacking, that if we had this, if we were able to educate our patients, or rather our people in the communities out there, out in the outskirts, we'll be able to probably raise awareness or a campaign that would actually help us to learn more about oral health education, or rather to learn more about education in the health kind of sense. And the fact that we're lacking this structured kind of system, it makes us kind of go back a bit because we're having a hard time to be able to reach out to people, to be able to come to the dentist, or rather to the hospital at an earlier stage where they would have to avoid all these things that could have happened if they knew how the process of diseases go by and how to take care of their oral health before that can actually get to a worse stage. So if we would have a structured oral health education system, we would be able to teach people through awareness, through campaigns, through dental missions, through everything else that we can do, through these the hospitals that we have, Adventist hospitals that we have in Malawi, or rather in the southern part of Africa. Now, if we don't have this kind of education system, that's where the problem lies, because people end up coming to the hospital really, really late when it's already too late, and we'd have a hard time to help them understand that now we can only help this much. We can't help any more than this much. And it's hard to tell someone that. So we would like to have that kind of structured system to educate these people. Now, what I found, I did a little research, and it's still going on. I'm still going about it, but this is what I found, that some dental practitioners do not go for checkup at all. So now, if dental practitioners did not go for checkup at all, how hard is it to tell someone, or a patient, or someone that comes to you about dental education, or rather about health education? How can you tell someone that, right? If I'm a dental practitioner, I should be able to go for my general health checkup at least once a year. But if I don't go at all, there's no reason for me to tell you as a patient, if you come to my clinic, that you should be going for a general health checkup as well, because I don't do it myself and I don't practice it myself. Now, another one that we found is that the dental visit frequency. This is how often do I go to the dentist? How often do I go check for my teeth, or do I just go for my oral health? And we found out that most of them, or most of us rather, we go only once a year. And usually it's supposed to be every 6 months, which is two times per year. And also, the majority, at least on this part, when I asked them this question, I asked, how often do you tell your patients, how often do you educate your patients when they come to your clinic? And they say almost always. So that was good. That was a good start of it. But at the same time, we still, although they come to us, we still need to go out in the communities and help them out by educating and putting out, establishing and structured oral health system. And also, we go to the dental mission participation per year. Now, this is supposed to happen at least 3 times per year. But now, when we went through the observations and the findings, we found out that there's only a few, like the majority say, yes, we have gone to a dental mission before, but it was only 1 time per year. It's supposed to be more than that. And that's where the problem lies, because if we don't have these dental missions at least twice a year, we won't be able to educate these people or educate everybody else in the outskirts of the city, or rather in the villages where people don't really know anything about education, about health, and more to be specific about oral health. So as I've spoken about, these are my observations, and I've observed that we have a lack of passion in the way dental practitioners do things, and the way we treat people, the way we treat patients. It's sometimes sort of hard. Maybe we're just used to it, and maybe we're just we maybe haven't had some sort of motivation to do this, to teach to people, to educate them. And also, there is no structured community or a healthcare system or program, as I've spoken about, and which could happen with awareness when it comes to screening. We could check the body, we could check the oral cavity, we could check the mouth to make sure that you are okay, or to make sure that you can come to the dentist or to the doctors to come so that we can see what we can do for you at an earlier stage before any disease goes on an advanced stage. And we do have stakeholders' efforts, but they're not, we have a program called, it's a Palmolive Colgate program. They do educate about oral health, but it's not as much as a dental practitioner should be doing. So it's not so much, and it's not that adequate as well. So now, what can you and I do, or what can we do as Adventist professionals, business persons, and supporting ministries? What can we do? We could start with actually we could start establishing a dental school in one of the schools, in one of the hospitals that we have. We have Kanya in Botswana, we have Malamulo in Malawi, we have Maluti in Lesotho, Rusango and Mwami in Zambia. We could establish something that could start this education, or better yet, we could also establish a new one altogether. And what can we do right now is we could always have an awareness expos, campaign screening, and treatment camps where we go on dental missions and we talk about these things. We educate these people outside of the cities, and we bring about awareness of them to know more about oral health care and to understand that there is an importance of your oral health care, and that you don't need to come to the dentist or to the hospital only when you feel pain, and that it is important to come to the doctor's office, or rather to the dentist, at least maybe twice a year, at least. You can even go more than that. You're more than welcome to. But we need to have that structured oral health system program that we can help out our fellow other people that are not very aware of everything else that's going on, especially with the oral health. And Ellen G. White says, someone must fulfill the commission of Christ. Someone must carry on the work which he began to do on earth, and the church has been given this privilege. Those who have been engaged in this Christian help work have been doing what the Lord desires them to have done, and he has accepted their labors. And it continues to say, that which has been in this line is a work which every Seventh-day Adventist should heartily sympathize with and endorse and take hold of it earnestly. And just an appeal that we know what the problem is, and we have gone through it. We're seeing the observations that are going on, especially in the southern part of Africa, to be specific, in Malawi. And I would like to just plead with you to see what we see that the need is there, that we do need you people to come and help us out. And in this sense, we can educate these people outside so that we won't have to have the problems of not being able to treat someone because they came at a later stage. If they knew from before that they should have came at the dentist or at the doctor's office for at least twice a year, then we would probably prevent a lot of diseases that occur over time. Thank you so much.